Good morning. Today we are going to be seeing about the ductal system of the salivary glands. Salivary glands are basically exocrine glands. A duct is basically a circumscribed channel leading from an exocrine gland. Here, the salivary gland ducts carry saliva from the gland to the oral cavity. The parotid gland's duct is called the Stenson's duct. The duct of the submandibular gland is called the Wharton's duct, and the duct of the sublingual gland is called the Bartholin's duct. The basic function of the ductal system is the transport of saliva from the salivary gland to the oral cavity. It also actively participates in the production as well as modification of your saliva. Moving on with the classification, ducts can be broadly classified into intralobular ducts and interlobular ducts. As you all know, the salivary gland is divided into multiple lobules. If a duct is present within the lobule of a salivary gland, it is termed as intralobular duct. If a duct is present between the two lobules of a salivary gland, we call it interlobular duct. The salivary gland ducts are classified as interlobular and intralobular based on their location. If you look at the image given below, represents a histopathological section of your salivary glands. Here, the ducts that are present between the two lobes are called as interlobular ducts, while the ducts that are present within a lobule is called as intralobular duct. So coming to the organization of the ductal system, the ductal system is organized as three tiers. From the acini, the first tier is your intercalated duct, followed by your striated duct, and finally your terminal excretory duct. Now let's see about the histopathology of the different sections of the duct in a little detail. The first is your intercalated duct. The saliva first passes through the intercalated duct from your acini. These are the smallest ducts of the ductal system. They are intralobular in location, that is, they are located within the lobule of a salivary gland. Coming to the cell morphology, these intercalated ducts are lined by simple cuboidal epithelium. Under the microscope, your intercalated ducts are lined by cuboidal epithelium and usually have a very large lumen. The cells are cuboidal in shape with a centrally placed nucleus and scanty cytoplasm. One can also notice myoepithelial cells located along the basal surface of your intercalated duct as shown in the image. So what are the functions of the intercalated duct? So the first function of your intercalated duct is the passage of saliva. So saliva passes from the acini to the striated duct via your intercalated duct. Secondly, it contributes to certain enzymes such as your lysozyme and lactoferrin into your saliva. Thirdly, it acts as a reservoir of undifferentiated cells. That is, if there is an injury to your intercalated duct, undifferentiated cells will multiply and replace the cells that have been lost. So the next is your striated duct. So these striated ducts receive the saliva from your intercalated ducts. That is, saliva from the acini passes to the intercalated duct and then onto your striated duct. These ducts are larger when compared to your intercalated duct. They are again intralobular in location. That is, they are located within the lobule of a salivary gland. Coming to the cell morphology, the striated duct is lined by simple columnar epithelium and they form the largest portion of your ductal system. So under the microscope, the striated duct is larger in diameter when compared to your intercalated duct. They are lined by simple columnar epithelium. These columnar cells have a centrally placed nucleus and a pale eosinophilic cytoplasm. Striations can be seen in the basal cytoplasm, that is, on the basal surface, numerous lines or striations can be noted. Under electron microscopy, these basal striations have been revealed to be highly infolded basal cell membranes. That is, the basal surface of the columnar cells are folded multiple times and these foldings are studded with numerous mitochondria that gives the appearance of striations in light microscopy. Under electron microscopy, one can also notice secretory granules and other cellular organelles like your lysozymes, peroxisomes, and deposits of glycogen. One can also note well-developed tight junctions and junctional complexes between the cells. So what are the functions of the striated duct? So the first function of your striated duct is to modify saliva. So the saliva that is usually produced by your acini is isotonic in nature. This isotonic saliva is converted to hypotonic saliva by the action of your striated duct. So how is this done? This is done by absorption of sodium and excretion of potassium ions. Your striated duct also synthesizes and secretes certain glycoproteins such as kallikrein and epidermal growth factors. Coming to your terminal excretory duct, your excretory duct receives saliva from your striated duct. So, saliva that is produced in your acini moves from the acini to your intercalated duct. From the intercalated duct, it moves to your striated duct, and from the striated duct, it finally moves on to your excretory duct. The size of this duct is larger when compared to your striated duct, and it is located in the interlobular location. That is, it is located in the connective tissue septa between the lobules of your salivary gland. So coming to the histology of your excretory duct, near the striated duct, your excretory duct is lined by pseudostratified columnar epithelial cells, while as it nears the oral cavity, the epithelium is changed to stratified squamous epithelium. So what are the functions of your excretory duct? So the first function is the passage of saliva into the oral cavity. So it receives saliva from your striated duct and transfers it into your oral cavity. The second function of your excretory duct is the modification of saliva from isotonic to hypotonic. Again, this is achieved by reabsorption of sodium ions and excretion of potassium ions into your saliva. So, just to recap, your salivary gland ductal system is organized into intercalated ducts, striated ducts, and excretory duct. The saliva that is produced from your acini travels through your intercalated duct, then to your striated duct, and finally your excretory duct. The acini produces isotonic saliva, which is modified by the salivary ductal system into hypotonic saliva. The intercalated ducts are lined by simple cuboidal epithelium. The striated ducts are lined by simple columnar epithelium and shows numerous basal striations that are nothing but basal infoldings of the cell membranes that are studded with numerous mitochondria. And finally, your excretory duct is lined by stratified squamous epithelium as it nears the oral cavity. So how is saliva modified by the ductal system? As I mentioned previously, the saliva that is produced from your acini are isotonic in nature, and the saliva that reaches the oral cavity is hypotonic. The saliva has to be changed from isotonic to hypotonic, and this change occurs via the ductal system. The saliva is modified from isotonic to hypotonic by the reabsorption of sodium and chloride ions and excretion of potassium and bicarbonate ions back in the saliva. This modification most commonly takes place in your striated as well as excretory ducts. So coming to the clinical consideration, if there is any injury to the ductal system of your salivary glands, it can result in a lesion called as your mucocele. That is, any injury to your salivary ducts can cause the saliva present within the ductal system to pool outside within the connective tissue, causing a lesion called the extravasation type of mucocele. Similarly, when salt deposits begin to occur within the salivary ductal system, it can result in the formation of stones within the ductal system called as silolithiasis. The cells of your salivary gland duct can undergo certain malignant changes which can result in the formation of tumors. These tumors can be either benign or malignant. Thank you.